Well, the glimmers of hope in Spain and across Europe are the result of what we have been doing, or maybe I should say what we have not been doing. A new study by Imperial College in London finds that interventions in 11 European countries, such as social distancing, have limited the spread of the coronavirus and saved tens of thousands of lives. Alex Gandy is a professor and chair of the statistics department at Imperial College London. He worked on this new study. Professor Gandy, it's good to have you on the day. Tell us, how were you able to determine that social distancing has prevented infections and thus saved lives?
Well, we put together two pieces of information. One is the observed death with COVID-19 in 11 European countries, and the other is what we know about the progression of the disease caused by the virus. For example, we have some rough guesses of what the fatality rate would be, how long incubation periods are, and for example, how long people stay infectious. Using that information, we can back calculate from the observed death to the number of infections that must have been there to cause these numbers of deaths. And then from these number of infections that we have, we can see how these infections have changed and infer how the interventions have changed the rate of infections.
Are you able to see in these numbers, Professor, countries where intervention has worked better than in others? I mean, I assume Spain and Italy are on the bottom of the list because they've had so many deaths.
As hard as it's not a very easy picture there, because so far the countries are not equally advanced in the epidemics. Spain and Italy are very much advanced. Now, what we've assumed in our study is that the interventions in all of the countries have a very similar effect. So basically we used information from the more advanced countries to say what these interventions would do in the countries with the less advanced epidemics. So it wasn't specifically a study of how well these interventions worked in an individual country, but more how overall they work.
Okay. In your study, you say that interventions should remain in place until the transmission levels drop very low. How do you define low levels, and can we predict today when those levels will be reached?
Let me try to explain a bit how this works. So if you have, in any epidemic, an important number is the number of new infections you have per actually infected case. So per people that have in the virus, how many do they infect? If that number is above 1, then the epidemics continue to grow. If it's below, the epidemic will slowly die out. Now, what we have seen, or slowly, but it depends on how far it is below 1. If it's very, very much below, it will drop, will end quickly. What we've seen in our study, we can see that this rate has already dropped down to values around 1. We know it's somewhere sitting around 1, but we don't quite know whether it's above or below, and if below, how far below. Okay. That will become clearer in the coming days and weeks as more data becomes available.
Okay, so you're looking at the rate there, and if it gets close to 1 or below 1. As this pandemic is still taking place, talk to me about the caveats of your study. What variables are you most worried about here?
I think with all of these studies, we need to be very careful. They are all based on a lot of assumptions, and ours, of course, is no exception to this one. We try to be particularly careful of not using reliable information as much as we could. We base it on the number of observed deaths. We don't observe it on the number of reported cases, which varies quite a lot per country, because some countries do more testing than others. But of course, in our study, some assumptions that are important in there is the properties of how the COVID-19 disease progresses. For example, how many people die amongst the infected. That's a certain assumption we've put into the model. Or how long do people stay infectious? So these are assumptions that are in there that can change the entire picture. And the other assumption was the same effect of interventions across all countries. Again, at the moment, we don't have enough data to determine effects per country. That will change over the coming weeks and months. But at the moment, basically, the only thing we can say for certain is the interventions having an effect. They bring the rate down. It's not quite clear whether it's enough yet. It could be enough, but time will tell.
Well, can we say that if there had been an EU-wide lockdown with social distancing, the death toll today would be considerably lower? Can we say that?
It's very hard to say these kind of things, and it's quite I fully understand why you would want to know whether we could have done things better. I think that's probably something for the coming years to figure out how we should have reacted to the epidemic and how we can react to future epidemics. The only thing we can say for certain is that we can say that the interventions that are in place at the moment, they are saving lives. So what our study looked at, for example, is how many lives have already been saved until the end of March. So that is basically saying how many people would have died until the end of March without the interventions that are already in place. And that number is already in the tens of thousands, as you've said.
Yes. Your study, Professor, it's a cautionary tale to political leaders who ignore the data that is before them. Would you agree with that?
I think the entire epidemic is a cautionary tale to the entire world that we need to prepare better for these eventualities. Now, but it's quite clear that around the world, I think the politicians are listening now to science, trying to understand what is going on. But the truth of the matter is, we don't have all the answers yet. We simply don't know fully how the virus behaves. We don't know what kind of measures we will have in place in the future, whether at some point we'll be able to, what testing we can be doing, whether we have some vaccination in the future. Everything is not quite clear yet.
Yeah, well, let me end our talk then, maybe on a positive note. Maybe there's a silver lining here. Keeping the social distancing in place for now will save lives and it will hasten the pandemic's end. Can we say that with certainty tonight?
We can certainly say that keeping these interventions in place will reduce the number of infections for the time being until either the epidemic dies out on its own or we have other things in place. For example, a vaccine coming on stream.
Exactly. Well, Professor Alex Gandy, we appreciate you taking the time to talk with us. Your insights are valuable, especially now when so many lives are being lost. Thank you.
Pleasure talking to you.